So we'll point out the chambers first. So thick wall is left, thin wall is right. So those are the ventricles anyway, so that means we have a right atrium, right ventricle, I'll just show you on the half, left atrium, left ventricle. So there on the outside then, here is right atrium, right ventricle. So if we come up here, you have the, what is it on your all's list? Okay, here it's superior vena cava. Comes into the right atrium, as does the inferior vena cava. So if we open that up, we're in right atrium. Here was the inferior vena cava coming in. The superior vena cava here also comes into the right atrium. So come down through the tricuspid valves, which are here. I don't know if there's a better, it looks better over here, I guess. So tricuspid valves lead into the right ventricle, and then the right ventricle will then pump out to the pulmonary circulation. So we stick a probe, see the pulmonary trunk is moving, and there's the probe. So just reference superior vena cava is here, pulmonary trunk's over here. It would branch out into pulmonary arteries to go to the lungs, and then pulmonary veins bring back the blood to the left atrium. So open that up again. Left atrium, coming through pulmonary veins into the left atrium. Then we have, flip back here because it looks better here, bicuspid valve leads into left ventricle. Left ventricle, I guess we'd have to cut in here to see like semilunar valves and all that, but they go through semilunar valves. And yeah, okay, so left ventricle, so that's the aorta. The aortic arch would do this, and the brachiocephalic is there. So we just came through the left ventricle underneath the bicuspid valves to get all that. Is there anything else we need to do on this?
We need the coronary arteries.
Coronary.
Just know you pointed it out.
Yeah, we looked at them. You can kind of see what's happening out here. You can see them better on some of the cats, or I mean the rabbits, because they're injected with red. I'm not gonna pin these, but there are some coronary vessels in here.
Do we need to know the common carotid artery in the subclavian?
It's not on here. They would be like here.
So this is everything
I think so. Some of the other. Do we have an actual list?
No, just this.
Just this. Okay, so yeah, aorta. Oh, I mean, some of this we already pointed out. Are you still recording? So apex and of the heart and base of the heart is up here. Arteries, atrium, auricle. The auricles are associated with the atria. We did bicuspid, brachiocephalic, the chordae tendineae. There are these cord-looking things off the valves. Don't worry about the coronary artery, the vena cava we got. Interventricular septum. Must be between the ventriculars. Alright. Papillary muscle. I think that's just these muscle bands in here. The semilunar valves we didn't see because you had to cut into it more.